All right, then I will go ahead and get started. My name's Julia Acken. I'm a labor and employment attorney at Jennings Strauss. And so your management asked me to come in here and train you guys on what you should do when you have a patient or a patient's companion that is hard of hearing or clinically deaf. So I do have about an hour planned. Yay! So with some examples at the end, should we run short. I will warn you, however, that I've been asked to turn off my cell phone completely because it will interfere with this microphone. So should it start to be, 1:30 or something, somebody flag me down and tell me it's time to stop. Okay? Great. So, first of all, why is this important? Well, right now in the United States, approximately 1 in 20 Americans is hard of hearing. And by this we mean hard of hearing to the extent that it actually interrupts or interferes with their daily life functioning. Of those individuals, approximately 1 million Americans are actually functionally deaf. So you will end up having patients like this, and it's important that you understand sort of the nuances around how you can communicate effectively with these individuals. So why is it that you're even required to offer this type of service? Well, you are a public accommodation because under the Americans with Disabilities Act, which has also been adopted as a state law in the state of Arizona, anyone that is open to the public or provides services to the public is considered a public entity for purposes of the Americans with Disabilities Act, Title III. So you are in fact required to accommodate individuals with disabilities so that they can enjoy your goods and services just as anyone else would be able to. Okay? The same is true under a different law, Title VII, of individuals who are not native English speakers. Okay? We won't be touching on that a lot today. However, one thing you do need to keep in mind when you're looking at what sort of auxiliary aid you're going to provide a patient or a companion is this individual a native English speaker? Because if you provide your hard of hearing individual with some sort of transcription service in English and they don't speak English, that's not very effective. Okay? So who is it that's entitled to receive an accommodation? I think the easy one would be your patient, right? You know that when your patient comes in, they're the one that you are actually treating and they are entitled to a reasonable accommodation. However, what most people don't realize is that that individual's companion is also entitled to a reasonable accommodation. So, excuse me. So a companion is anyone that is an adult, and we'll discuss that further later, but who comes with this individual as either a spouse, a family member, or they say very generally, another adult that it would be reasonable to speak to about this individual's health. One thing to keep in mind, when you're accommodating someone, you would treat them just like you would someone that had hearing. So if you typically would obtain, say, a HIPAA release before you released information to a companion, you need to do the same thing in this situation. Okay, you treat them just like you would anybody else because you are providing health information. So what types of auxiliary aids are available? I'm only going to touch on a few. And frankly, you guys are primarily going to utilize 2 or maybe 3 different kinds, which is pretty typical. But I want you to at least know what's out there because sometimes individuals will arrive with a particular type or they will request a specific type. And I at least want you to be able to sort of speak to them about what it is and maybe offer an alternative that would make sense based on what they're requesting. The first is a live translator. And I have here an ASL, American Sign Language translator. There are actually a few different types of sign language. The most common is American Sign Language, but there are some other, almost dialects, if you would, of sign language. So if you've got someone that does sign, you want to make sure you know which type, and you will have translators certified in each different type. The most common, and what you are going to rely primarily upon here, is video remote interpreting. So who here has ever used this already? Anybody? Okay. Because this is a great service and it's very economical when you're able to use it. Some places even invest in one where not only can you get a translator for American Sign Language or different types of sign language, but also up to like 80 different languages, foreign languages. So this can be sort of an all-in-one accommodation for your patients. And with video remote, with VRI, you actually use usually an iPad or a laptop, whatever setup you have, and you call, kind of like FaceTiming, the translator. You will have set this up in advance, so when you call, they pick right up, and you literally just have a person sitting there on the screen as if you're Skyping or FaceTiming them, okay? Also, telecommunications relay service. This is one you definitely want to know what it is, because if one of these calls you and you hang up, that's a bad thing. Because there's actually, and this was set up as part of the ADA, the Americans with Disabilities Act, is there is now a free service where if you dial 711, you will be connected to someone that can use one of these text telephones, which is what a lot of individuals who are hard of hearing or deaf use, where on their phone, they're actually typing in what they want to say and they're reading what you're saying. Well, you will actually, if you call 711, reach an operator who will make that contact for you. They'll listen to what you're saying and type it on their device through to the individual. So that's how you would make an outgoing call, but you also often will receive one of these calls. Let's say someone's scheduling an appointment, and it will be the operator that contacts you, and they will just say, hello, I have a call from an individual that uses a text telephone, and then they will proceed with the phone call. Okay, so just expect for your own scheduling, if you're scheduling appointments with these, it's going to take a little bit longer than your typical phone conversation. Computer-aided real-time transcription. This is an aid that a lot of individuals use who have disabilities, but that is not very frequently used in a context like this. But essentially what this is, they call it CART, is someone, a transcriptionist, who is also sort of like the video remote interpretation. That person is going to sit there and transcribe in real time what is being said in the conversation so that the individual can read it. Okay? Now this is another one where you want to ask yourself things like, what language does this individual speak? Is this person literate? Things like that. Note takers. Sounds very similar. It pretty much is what it sounds like. This is when you're writing back and forth in handwritten notes. This type of aid, if you want to call it that, is okay to utilize in certain circumstances, which we'll talk about. This isn't something that you would want to do if you were having a lengthy, complex appointment or something. It wouldn't be very practical. But for some simple purposes, or maybe someone just walks in and asks, to schedule an appointment, something like this might be what you end up going with. And last, closed caption decoders. I would imagine if you have television sets out in your lobby or what have you, you probably have something like this already on there. And this simply means that you're going to have those captions appear at the bottom of the television. Okay, so certainly if you're ever doing any work, in hospitals, any groups that have multiple television sets, this is something that is typically required. Okay, the last, this is sort of a catch-all, and this is assistive listening systems and devices. This is something that you use more often, and this is something you might see someone arrive to your office with. They may bring their own. And these are really sound amplifiers. So for someone that's not clinically deaf, but who is hard of hearing. And they come in all shapes and sizes. Usually they're either some type of phone or some type of headphone device. So they may simply be listening through this amplifier. They'll have a sort of amplifier that's picking up what you're saying and amplifying it. Or they'll have a number of different types of telephones that either amplify sound or that simply, it sounds kind of funny, but that accommodate the use of a hearing aid. If you have a substantial hearing aid, there are phones that adapt or fit with that hearing aid so that you can use it more easily. Okay. So this is the big key. This is what you always want to go back to when you're asking yourself what you need to provide your patient or companion. And that is, what type of aid does this individual need in order to communicate effectively? Okay, that's a broad term, but think about it. What types of things are you going to have to consider when you're looking at how to communicate effectively? So step one, and this is actually what the law asks you to consider, the law tells you what to consider, is determine the patient's communication needs. That's going to be step one. Preferably, this will take place during the scheduling process, okay? If someone calls you and they're using a TTY operator, there's a good chance that individual is going to need some type of auxiliary aid when they come for their appointment, right? So try to catch that then. If you have new patient paperwork, make sure there's something on there or that you indicate in writing that you provide these types of services so that the individual knows and they can request those, okay? So, do they understand or use ASL? So whether you're providing a live in-person interpreter or you're using VRI, you need to know whether this person signs. I think I thought when I first started practicing this area that all individuals who were deaf or hard of hearing used ASL. Not at all. I mean, it's, you know, it depends. If someone got, especially if someone lost their hearing later in life, they're far less likely to actually use ASL. They may read lips because they have had hearing in the past or have some other sort of adaptive way of communicating that is not ASL. So that's number one. Are they able to read? This could be perhaps limited English proficiency, could be age, you know, if you have a child, obviously, or perhaps the individual, unfortunately, is illiterate. Something to consider if you're going to accommodate this person. Do they have speaking difficulties? Again, depending on when an individual loses his or her hearing, they can have any variety of speech issues or clarity. If they lost their hearing late in life, they may have very clear speech and it's not an issue. If not, they may have a lot of difficulty with speech. And if that's the case, you not only are going to need someone to translate what you're saying for that individual, but you're going to need someone to translate what that individual is saying back to you. So if they sign, great. The individual, the interpreter is going to give you both. But if they don't sign, then you can even get into situations where they're having to write to you, or there are even translators, if you got into a really sticky situation, that are practiced in listening to and understanding difficult speech, people with various types of speech impediments. So. And again, you want to determine this as early as possible. If you don't get it at the scheduling stage, then perhaps when the person arrives, if it's obvious looking at them, like they're wearing some sort of assistive device, begin the conversation then. Okay, it's just like any other individual with a disability. If someone were to come in and they were in a wheelchair, you'd want to make sure you put them in a wheelchair accessible room, or that you ask them if they needed assistance getting out of the chair and onto the table, that sort of thing. Same thing, as soon as you can visibly tell or otherwise tell that someone might need a hearing accommodation, you engage in that interactive process. Step two, and this really I think is the more subjective, probably the more difficult analysis, is consider the type of visit. So the nature, length, complexity, and context, as well as the person's usual method of communication. So basically, you are going to want to use a live in-person interpreter for the very complicated types of situations. When you're having a lengthy discussion with a lot of complex medical terminology, and also if the individual, for whatever reason, is not able to view the VRI properly because of their condition. So just a few examples here, okay? Situations where a live interpreter may not be necessary. Just as a general rule, they're probably not going to need one here. So, if the individual does not sign or understand sign language, doesn't make sense at that point, you're not going to need a live interpreter. If the appointment is short or is not going to require a lot of communication. The most common would be someone who's coming in to drop off a urine sample, have blood drawn, something like that, where really the extent of your communication is going to be to point them to the room where they need to go and then say goodbye on the way out. So You're not going to need some sort of live interpretation for that individual. And then other communications that are maybe secondary to the appointment. So let's say when the person comes out, even if they had a live interpreter or an in-person interpreter or VRI while they were in the actual room, then when they come out and go to the front desk and they have to pay their copay, maybe schedule a follow-up, something like that, you're probably not going to need to continue using an interpreter or even VRI at that point. You can use hand gestures, you can write, that sort of thing. So, situations where a live interpreter is likely to be necessary. And it's important to understand here that when I say a live interpreter is likely to be necessary, that means this person is going to be justified in getting that in-person interpreter if they request it, okay? These live interpreters, the reality is, typically the cost of the service is greater than the payment you're going to receive for that appointment. And the law says it doesn't care. They're looking at you as an entire business's ability to cover the cost of this service. They're not looking at, am I going to make it, am I going to break even on this particular appointment? Law doesn't care. However, it is okay to say, and you guys do have a VRI contract, to offer VRI first, okay? But if the individual says, no, that's not going to work for me, then provide them with a live interpreter, okay? So these are the more, what the law would consider the more complicated. So you're definitely going to want to use at a minimum VRI. Discussing a patient's symptoms or their medical history. Describing different medical conditions. So if you're telling them, well, this could be X, Y, or Z, or do you have this symptom? Do you have that symptom? Or giving them some sort of explanation or instructions regarding medications. Informing a patient of his or her diagnosis or prognosis and recommending treatment. I mean, you're going to want to make sure this individual is going to be uncomfortable. You want to make sure that they understand exactly what you're saying in a situation like that. Also, what if the patient's condition makes viewing VRI difficult? I know when I've worked with healthcare institutions in the past, this has happened when individuals were laying down. So maybe it was a post-op appointment, or for whatever reason they were laying down during the appointment and they weren't comfortable having to look at this screen, or it was very difficult for them to look at the screen, because if you're holding it or looking at it, then how are you supposed to sign back? And it just created all of these kind of logistical problems. Giving instructions for treatment and follow-up. Discussing treatment as it occurs. So maybe during a procedure, hey Mary, we're gonna put you to sleep now. Let's see what happens, and the normal kind of discussion that takes place during a medical procedure. And then this one's interesting. All behavioral health services, at least according to the law, whether it's individual counseling or group counseling, this is considered sufficient communication and complex enough that you need to provide at least VRI for this individual unless they flatly refuse it during all individual and group therapy. And then my favorite, the legally significant conversations. So this is when I think of it as almost tantamount to making sure someone is competent to consent to something. They also have to understand what it is you're requesting. Okay, so if they're supposed to give informed consent, with billing issues, let's say you're collecting from them. You want to talk to them about a big overdue notice and how you're going to send them off to collections, something like that. Or if you're talking about something like a power of attorney, maybe they should grant a power of attorney to a relative, or maybe they should look into a living will. These are situations where you need to make sure that individual fully understands. So in that case, you're going to want to offer a minimum of VRI for those conversations. So, what role should cost play in your decision? Basically none, according to the law. If you reach a certain size of company, which you do, which is pretty much anything beyond a relatively small, 10 or fewer person company, the law basically assumes you have money to spare for this type of thing, okay? So you are absolutely prohibited from charging that patient any additional amount. You can't have a service fee, a convenience fee, whatever that is, or charge some sort of premium rate because they or their companion are receiving some type of accommodation. There is an exception in the law that says if it is an undue burden, you don't have to provide that particular service. Undue burden is an extremely high standard. It doesn't sound like it, and you'll hear people that don't know better saying, well, that would be too burdensome, we're not going to do that. No, it has to be like fundamentally altering the nature of the service. For example, in the physical accommodation context, the example that is always used is if you are the guy that checks people's IDs at the airport, you don't have, if the individual's blind, you don't have to hire another guy to check IDs at the airport for that guy. Okay? That's about as extreme as it needs to be considered an undue burden. Okay? In addition, the decision should be made regardless of what type of coverage the person has or whether they have insurance coverage. It is okay to say, oh, this person is insured by Cigna, and Cigna requires that we go through this agency to set up VRI. That's okay. That's, you know, if you want to follow their procedure so that you get reimbursed or what have you for that particular type of accommodation, that's fine. But what you can't do is say, oh, well, Cigna doesn't cover this service, so we're not going to provide it. We're just going to do written. They do written, they don't do VRI, so we're only going to do written. No, you can't do that. You would then just have to out of pocket provide that, the appropriate aid, if that's what you need to effectively communicate.
Question?
Yeah.
So if they are accessing a commercial insurance, and you're the provider, who's the one who is responsible ultimately for the cost of the interpretation?
I would say the provider. Yeah, typically. I mean, you know, that would be one of those situations where you could get into it with the insurance company. Let's say they provide one service but not the other, and you say, look, we're legally bound to provide this. They may, in that sort of situation, provide you with, you know, like their cost or some sort of reduced rate, something like that from the insurance company. But ultimately, it's on you as the provider because you're the one providing the service. So, VRI. Since no one's used this will be a good opportunity. So how does it work? Now, with respect to who you need to call and the numbers and the different insurance coverages, all of that is outlined for you guys in your language assistance policy. Okay, so for the logistics of how to set this up, you're going to just refer to your own internal policy. But generally speaking, probably a minute or two before you call the patient into the room, you're going to call. It's just like a Skype call. You're going to call the translation service. You will have been given a code, and you're going to connect to this individual who does American Sign Language or whatever version of sign language you need. Okay? But there are a few things that you are required to make sure occur when you're using VRI. And if for some reason one of these things goes south, you need to come up with an alternative method. So first, you have to maintain real-time, full-motion video and audio. This is designed for if you have, you know, dial-up internet and the person's jerking around, you can't really tell what they're doing, you're not effectively communicating. All right, VRI that works properly might be the appropriate choice for this patient, but if you're not able to provide it effectively for whatever reason, then you have to look for an alternative. In addition, American Sign Language uses a number of things. I don't know if you've ever noticed or ever watched someone that's signing, but it's not just their hands. They also are moving their mouth, and they're making certain facial expressions, and all of that is part of the signing. So you need to make sure that both the translator or the interpreter on the screen, that you can see from about here up, and that you can clearly see their face, that you have a good like HD quality representation of their hands and from about the waist up, because they're going to move. Certain signs take place lower, certain signs take place higher. And then the same is true, this is where it might be a little trickier. Let's say you're using an iPad. You need to position that iPad so that your patient, they are also visible to the translator from about here up, so that they can sign back to the translator. Okay? So, tips during the appointment. First, practice connecting to the service prior to the very first time you use it. If you're me, practice 85 times. Like, I couldn't make a Skype call right now. Most likely, I would mess it up. But so practice connecting at least once with somebody that's done it before, and they're actually really nice, these services. I've done this at meetings and things like that where we've called them up and said, oh, hey, we're just doing a test, and they're like, okay, and then you hang up and it's all fine. If the signal becomes unclear during the visit, first and foremost, communicate with your patient. Okay, angry patients file charges. Happy patients don't. Okay, even if there were mistakes that occurred. So communicate with your patient through the whole thing. Ask them, are you comfortable with this? Are you understanding? Do you want us to do something else? And they might say, oh no, but I really appreciate this. Or they might say, you know what, yeah, I'm really nervous. I need something else, okay? And watch and see if it becomes apparent to you that the individual is not understanding. This is also about checking in with your patient during the appointment. If you have someone that's utilizing VRI or even an interpreter, you should be checking in at least once during that appointment, probably right after the appointment begins, and saying, is this working for you? Are you comfortable with this? And just checking in. But you know, if the person, this might happen if they start asking a lot of questions that maybe you weren't expecting, or in general the appointment becomes more complicated than maybe you had thought previously. And you can tell that this individual is not understanding. Or if you're having internet connectivity problems, that's probably going to be your number one issue. And that's certainly the number one complaint that you hear individuals who are hard of hearing making is, I can't understand the VRI because it's jerky and they're coming in and out and I'm not getting a clear, I mean, signs move. You know, like a sign might include a movement. And if you only see, you know, the beginning and end of that, how are you supposed to understand what they're saying? So if they look confused or you yourself can tell, this maybe isn't what I had in mind, check in, see if you need to do something else, okay? You pretty much already covered this. Oh, use VRI in a room with sufficient space. Okay, you might want to have a slightly larger room for this so you can make sure that you can position your iPad or whatever it is that you have in the right place. This might not be the time to do the very end room where you're all kind of sitting on top of each other with a little table. Just make sure that your room is suitable. Okay. How do you arrange for an in-person interpreter? So again, the logistics of this are all outlined for you in your policy, in your internal policy. And you're going to start with, hey, we offer VRI. Is that going to work for you? The individual says, no, I have to have a live interpreter. And I tell you this, just to be perfectly honest, some people, they just really do prefer a live interpreter, especially if they're nervous. But also, right now there are a lot of advocacy groups who are testing this law, and they're actually sending in testers who will ask you this, okay? They'll say, no, I don't want VRI, I want an in-person interpreter. And if you say, oh, I'm sorry, we just offer VRI, boom, you just violated the law and you're gonna get a charge, okay? So make sure that once the service is requested, you arrange for someone that is qualified. I don't know if you have anyone, boy, if you have somebody on staff that is qualified to sign, fantastic, but I'm guessing that's probably not the case. Something to think about. But if not, then you need to refer to your policy and identify, is this American Sign Language that this person needs? Is it a different type of sign language? And set up the service, schedule the service ahead of time so that that individual will get there in time for your appointment. We already covered most of this, but what if the patient is not insured? Doesn't matter. Okay, that may affect your internal logistics and how you set it up, what service you choose to go with, or this or that. But ultimately, if an individual is truly hard of hearing or deaf and they are insisting on an in-person interpreter, you're going to need to provide it. So, not just any interpreter will work. You need a qualified interpreter. The key to whether or not someone is qualified, and this is true also when you deal with foreign language use, is that the person needs to be able to understand receptively what is being said to them, and then also be able to express or to speak expressively in that language, in this case, in American Sign. Okay? Some people are very good at reading signs. They understand them. I mean, I think a lot of people are that way with foreign language. I kind of understand what they're saying, but I can't talk back. Okay, that's not sufficiently effective. You have to be able to do both to be qualified. In this case, most likely you're going to rely on someone that has actually been certified. It's not absolutely mandatory. If there's some other way that you can confirm that the person is effective at both receptive and expressive speech, but most of the time they're going to be licensed, certainly if you get them through an agency. Also, you guys are going to have some difficult terminology that people don't necessarily use in everyday life. So you need to make sure that whoever it is that's doing the signing for you, whether this is on VRI or in person, you need to make sure that person is familiar with the signs for these medical terms or these other terms that you might be using with them. If you do have staff members, you definitely are only going to be able to rely on someone internal if they have been licensed by some sort of outside or certified by some sort of outside agency. You can't just say, oh, I think such and such has a deaf sister, bring her in. No, that's not going to work. With some very minor exceptions that we'll mention later. Okay, what about the patient or the companion's friend or family member? Okay, so somebody walks in and their spouse is with them, and their spouse has hearing and knows sign language. Can you rely on that person to act as your interpreter? Probably not. Certainly if you are relying on them in lieu of providing a service that this person has requested, that's not acceptable. It's only appropriate if all of the following, and this is outlined in the regulations, is true. First, it's got to be the patient or the companion that requests it. Okay, so they say, oh, I'm not comfortable with interpreter. Don't do that. Really, my husband will be just fine. Okay, they have to request it. They have to be aware that alternatives exist as well. So if a person calls you up and says, yes, I'm coming in, but my husband's going to come, he'll sign for us. Whoever takes that call needs to say, okay, I have a couple of questions, but also I want you to know that we offer VRI here, and we'd be happy to set that up with you. You don't have to feel like your husband needs to sign. Just make sure they're aware that those options exist. Also, the friend or family member has to meet the technical requirements of being qualified. So you have to determine, is this individual able to speak both expressively and receptively? Really, the only way you can determine that is to ask, and hopefully they'll give you an honest answer. And then also, let's say that they get started and they start signing, and it becomes clear to you that your interpreter is not understanding what you're saying, like they're taking a lot of breaks, or I don't know how to say that. That's a red flag. You might need to contact your VRI provider at that point. And also, the friend or family member has to be 18 or over. And this is relatively new. People used to allow people's children with hearing to interpret for them. Okay? That is not allowed under any circumstance except an extreme emergency. Okay? And even then, only until an alternative arrives or is available. Okay, we do not rely on minors. They're not competent under the law to translate. Also, frankly, the law doesn't give a whole lot of guidance about this, but if appropriate, consider using standard flashcards or pictograms to supplement other auxiliary aids. Okay, this appears in just about every bit of legal guidance, settlement agreements, all of that. They have this language. Unfortunately, there are not a whole lot of universally accepted pictograms for, say, medical terminology, okay? But pictograms are visual images that help portray a medical term or some sort of instruction. Where I do think these can be useful, though, and where there are some pictograms out there is, for example, in medication instructions. And this is where you might consider having some of these on that individual's medication label or on their documentation. There are pretty universally accepted pictograms for things like take at night or don't get wet. Like the don't get wet pictogram is a little umbrella with rain. Doesn't seem all that, that to me doesn't say keep dry, but that's what it means. So there are some fairly regularly accepted pictograms for instructions. You also probably already have some of these around to make your building accessible. And an obvious one that's sort of a minor one would be having a little man and a little woman on your restrooms. I don't know, I hate it when I go to like some themed restaurant and you're like, I don't know what the coyote is. I don't know if that's a girl coyote or a boy coyote. But you're supposed to like have an easy to understand man or woman figure on the door. But more importantly, you will have like your emergency exits marked. You may even have Braille on some of those. So this is just to allow the person to kind of navigate your office safely. But also, some of these pictograms can come in handy when you're trying to find out what type of communication needs an individual has, okay? These are standard kind of universal pictograms. These are accepted worldwide. The CC, you've probably seen that because this has been a legal requirement for quite some time. That's closed captioning. So that's what you all have on your television. In the bottom right here, that's the universal symbol for hearing impaired. Okay, so if someone contacts you or sends you a communication and it has that symbol, that means they are hearing impaired, okay? The one in the middle is a little different. That's one that you would use to communicate to a patient or someone that says, we make auxiliary aids available, okay? In this case, this is usually used to mean some sort of amplification device, okay? And it actually kind of looks like it when you see the lines getting bigger. So that's showing, oh, we're going to use a TTY phone or something like that, or we have the amplified phones available. For example, if for some reason you made phones available to your clients, maybe they could schedule telephonically or something from your office, that's when you would probably see something like this that would say to this person, if you need a specialized phone, let us know, we have one. This is the universal symbol for American Sign Language. So that's a really easy way. If you have someone come in, you want to know if they sign, you could refer to that symbol. So maybe they read lips, and you could say, do you understand American Sign? Something like that, and point to this pictogram. And then up in the top right, that is a TTY phone. That's another one that you'll frequently see, either where a telephone is, or you might even put that on some of the literature that goes to patients to let them know that you're able to receive that type of phone call, that sort of thing. Or they can maybe get lab results that way, something like that. You would use that. All right. All right, so before I go on to some exceptions, any questions with what we've covered thus far? Okay. Yeah, sure.
There's a particular agency or service that the patient is requesting for either a VRI or a translator. Is that something, and say it's not what their insurance is providing, is that something that we need to, what they're requesting and who they're requesting specifically?
That's a great question, and I would say no. You need to provide the service if the service is appropriate. You don't have to go with exactly the company that the individual wants. And that actually comes from the regular ADA, where sometimes someone will come in and say, I've got this sleep disorder and I'm frequently tired, so I think I should have a schedule where I just come and go whenever I want and you pay me double. You're like, we'd rather use a different accommodation. You don't have to use the accommodation that they are requesting. Okay. So you guys would agree on the mode, but then it's perfectly fine. And I would probably even try, just to avoid, to hopefully kind of stop that before it starts. Just say, oh, well, if VRI is acceptable, we offer that service through blank, just period. But no, you're right that you don't have to provide their company. Okay. Anything else? Can anybody give me time? I want to make sure I'm not running over or under. Perfect. Okay. All right. emergency situations. Okay, everything changes when you have an emergency situation, right? It is permissible to use a less optimal form of communication in an emergency. So for example, let's say this person you know is going to use VRI. That's the level, it's a complicated appointment or what have you. But for whatever reason, let's say this person goes into some sort, cardiac arrest or something during your actual appointment, and VRI is not available or it's not adequate at that point. At that point, you can write to this individual, you can sign, you can use it, you can do whatever you need, because ultimately the health care is the primary consideration, okay? The effective communication is just meant to help the person receive adequate health care. So in an emergency situation, you just do whatever you can that is going to help them get the health care they need most quickly. I think you're more likely to have this situation with a walk-in or someone that just comes in unannounced in some sort of distress. Oftentimes someone like that, if they're very, very sick, a parent or a guardian is probably going to bring that person in and say, this person is, in great distress. In that case, go ahead and let that person sign for you until you can get something else, because you need to deal with this right now. And time requirements. Now, these are definitely best practices, okay? This, in reality, is going to be difficult to accomplish in a lot of situations when you have something, a wrench gets thrown in the works. Keep this in mind. It's a goal. It's aspirational. So, patients should be notified of the availability of accommodations at the time of scheduling, if at all possible. Okay, so when you make that first communication, you at least want them to know that accommodations are available. Just like people say, we're an equal employment opportunity, equal employment employer, or we will provide you with assistance. You see that at drive-throughs, all of that. That's why all of that signage exists, is this requirement. If a patient declines services, continue to offer services at various points through the process. So that's fine, especially if you have an individual that reads lips really well and speaks well. You can probably have a perfectly typical appointment with that person, even a relatively complex one. And if they say, no, I don't need any sort of interpretation, great. But when they arrive, I would say when they arrive at the appointment, check in with them again. Okay, so are you certain we're not going to use an auxiliary aid today? Is that correct? Or during, if they start to look stressed or confused, check in with them again. Okay, so you do have an affirmative obligation to make them aware that you're willing to provide an auxiliary aid, even if they've already declined one. And also document it if and when that individual has declined services. Okay, put that in their chart. Now let's say you have a returning patient. Just because they declined services the first time, that does not relieve you of your obligation to check with them again. Okay, so when they come back for a follow-up, ask them again. Well, for this appointment, would you like to have an interpreter? Maybe in retrospect, they didn't think the first appointment went that well. Okay, they're still entitled, even if they've turned it down once. So for scheduled appointments, you should have services available at the beginning of the appointment, because everything always goes as expected, always, right? No. So that's ideal. Certainly try to schedule it in advance, but sometimes interpreters don't show up, or they get lost, or they're late, or the client's late and they miss the slot that the interpreter was on, any number of these. Or you have a situation where your VRI, all of a sudden your internet's down and you didn't schedule an interpreter and now you need one. In those situations, you're going to have sort of relaxed requirements. The law says, and this is really coming from like the death advocacy groups, you should have that service in 2 hours. Okay, that'd be great. That is going to be difficult, I can tell you. But basically what you need to take away from this is, if something goes wrong, get it as soon as you can, okay? Don't dawdle. And don't just assume you can reschedule that patient and have them come back later. So let's say you have somebody that comes in unscheduled, or maybe they initially declined services and now they need them, or something has gone wrong. Then you need to look at what type of situation you're dealing with. If this is a pretty urgent appointment, like you've got someone who is ill and they need to talk to you about what's going on with them, you should try to call your interpreting service, and most of them will make somebody available for you. Okay, now I'm sure that's going to be at a premium. But if it's an urgent situation, you need to get someone there while the patient is there, or as soon as you can. If it's not urgent, it is perfectly acceptable, especially if you just have a walk-in who says, hey, I wanted to do my well check today or something. Well, you can reschedule that person for a time when you can schedule ahead and have an interpreter available or have VRI ready or whatever, feel comfortable that you have done the assessment of what this individual needs. Okay, so in those instances, it's okay to reschedule, have them come back later. And then, as I mentioned previously, in an emergency, you just do everything that you can. However, to the extent you're providing a less optimal service, like you're letting the spouse do the interpreting or what have you, if you're able to get a hold of someone on VRI, or you're able to get an in-person interpreter while that individual is still in your office, then initiate the better form of communication. Okay, so really these other forms of communication are only acceptable when you are not able to get the preferred method of communication. Okay. All right. Any questions before we go to my examples? They're on a different, I didn't put them in your thing because people cheat. And I don't want you to have the answers. So, but any questions before we get to the examples? This is my favorite part. You'll see that when, because I think I'm really funny and I make funny names. Other people probably don't think so. Here we go. Okay, still me, Julia Acken. All right. So, example number 1 is Susie Q. So, Susie Quinn is a new patient. She has scheduled a new patient appointment with you to discuss persistent pain she has been having in her abdomen. During scheduling, Susie, who called using TTY, and we all know that that means a text telephone, because we're all experts, and indicated that she typically uses ASL. The scheduler has asked you what type of auxiliary aid to make available to Susie for the visit. What should you tell her? And I will not move on until someone answers. So I'm patient. Yeah, go ahead.
I'll go first. So then we would want to ask her with the ASL, which ASL specifically, if there's like a dialect that goes with it, before we would offer the VRI services.
Exactly, that is correct. And this is one also where if the person asks for an in-person interpreter, they would probably be entitled to that, okay? So you would start with offering via VRI. You're going to want someone to translate via sign language, and then if they push further, you're going to go ahead and offer the in-person. The reason is you're going to have to get, this is her initial appointment, you're going to have to get her medical history, you're going to have to talk to her about her symptoms, you may have to talk to her about treatment. This is all of those, this covers 2 or 3 of sort of those bullet points that the law requires you to provide something like VRI or an in-person interpreter. Okay. Susie arrives at your office 30 minutes early for her appointment. She has brought her husband with her. Upon arrival, the front desk informs Susie in writing that an interpreter will be available at her appointment, but has not yet arrived. So in this situation, Susie has requested an interpreter, okay? Susie indicates that she is in a hurry and asks whether she can get in early and have her husband interpret. The front desk asks you what to do. Anyone? Yeah, go ahead.
I would say yes until the interpreter arrives.
Okay. Anybody else?
Ask your husband if he's a qualified interpreter.
Okay. I would say explore a little bit further. You should, in fact, ask Susie's husband whether he's familiar with both expressive and receptive speech. So find out if he's qualified. But in this case, even though she initially requested a live interpreter, she is now requesting, she's making the request that her husband be allowed to do the interpreting. So that is okay, as long as he is qualified to do so, okay? So again, there's not a perfect way to do that. I would just ask him, how familiar are you with sign? Do you know medical terminology? Those sorts of things. Try to do what you can to find out if he's going to be able to interpret for you, and if so, go ahead and use him. Like you said, until, if things go well, that's fine, you can use him, but otherwise, until you get your other, the interpreter arrives or whomever it is, you get your other accommodation in place. Okay.
Should we have the patient sign a consent form that they're going forward without the service?
That is certainly a possibility. In the very least, I would put it in their chart, make it very clear that when patient arrived, they requested for husband, and I asked, you know, whether he was qualified or something like that. So yeah, if you want to develop a consent, that would be fine. Or if you just put it, you know, real-time note-taking on your own part, that would.
Can you back up that real fast? So when we're scheduling and they're declining services, we should be documenting that as well.
Absolutely. Say services were offered and patient declined. Yeah.
I have a question about minors. When
Yeah.
servicing minors, as a guardian who we're looking for if they need interpretation or not, and what guardian
Yes.
is requesting for their child.
Yes.
Okay.
And even if you have, certainly if you've got a child and their guardian, but even if it's, say, someone comes in who is, you know, has hearing, doesn't have a disability, and they've brought their spouse, because this is a very serious appointment, let's say to talk about treatment options or something like that, that's a companion. Even though your patient is able to understand, you still need to provide accommodations for her companion, because it makes sense that that individual would be actively involved in this appointment and helping her with the follow-up and that sort of thing. Good segue. What if, instead of her husband, Susie brings her 16-year-old daughter, who is experienced in using ASL both expressively and receptively? Should you allow her to interpret for Susie?
No.
Oh, good. No. No, you should wait for the interpreter or VRI. You know, you can make something else available, but don't use that minor child, okay? Under the law, a minor child should not be used as an interpreter. Susie and her daughter, Susie's probably kind of ticked off now, but take a seat in the lobby to wait for the regular appointment time and the arrival of the interpreter. Just minutes after arriving, however, Susie suddenly collapses in pain, gripping her side. She appears to be in significant distress. You fear that Susie may have appendicitis and or a ruptured appendix. Keep in mind, I'm not a medical specialist. Maybe that is not what that means, but that's what I'm guessing. The interpreter has not arrived yet. What should you do? Everybody agree? Can you use the daughter?
Call 911.
Yeah, 911 would be good. Unless you have doctors available. Yeah, so, in that situation, until the ambulance arrives, proceed to use an alternative method for communicating with Susie. So it's okay to have the daughter in that instance translate, because that's going to be your best option right then, okay? Tell her to sit still. Tell her the ambulance is on the way. You know, whatever it is that you need to communicate with her. If your interpreter or something like that shows up midway through, great. Switch over to them. But until then, just use what you've got.
You have 4 minutes. 4 minutes.
Okay. Okay. Example number 2, new patient. Dan D. Mann is a long-term patient at your clinic. You know, see, I think I'm so funny when I do these. So Dan's chart, you know from Dan's chart that he is significantly hearing impaired and that he regularly uses ASL. Dan is coming into the clinic today to give blood for lab testing. The scheduler has asked you whether she should arrange for an in-person interpreter, or VRI, we can say in this situation. What do you do? Yeah.
If I'm remembering this right, so since it's just for giving blood or for the lab testing, we don't have to necessarily schedule someone for them, since it's not going to be like a lengthy conversation or anything from folks.
Exactly. No. You do not need to arrange for an in-person interpreter, most likely. I mean, assuming this is a pretty basic laboratory test. The appointment should probably involve very little communication, so an alternative method, such as VRI or written notes, most likely in this case, you're gonna have your front desk person. This is where you really need to get your front desk folks comfortable with that. I mean, that would be awkward, right? And you might be concerned that you're doing it wrong if suddenly someone comes in and you're expected to communicate. But if it's just for labs, they're just asking you which way to the office or what have you, just write or point. You know, do whatever you can, but it involves very little communication.
My question is, if Dan requested though, when he made his appointment, then we're gonna have to accommodate that, even for that particular.
That's a really good question, because technically, under the law, I would say, well, let's say you did it. Let's say you didn't provide it and I was defending you. I would say they didn't have to provide it. All they had to do was provide effective communication, and what he was requesting was not necessary to provide effective communication. That would be my defense. Realistically, do you want to be the one responsible for that charge that got filed? Probably not. So I would, in the very least, talk to a supervisor. Okay, especially if they're asking you an advice and it's something like VRI that you're probably already paying a certain rate or it's not terribly expensive. Probably should give them what they're asking for. But realistically, you're only required to provide them with effective communication. But that's a very good question. That's a good practical question. After Dan is done providing the sample, he asks to see the results of the labs that were done at his previous appointment. You pull up the results and see that Dan's labs show signs of cancer. Again, I don't know what kind of labs show that, but I'm a lawyer. So you have time in your schedule to meet with Dan. What should you do? Go ahead.
Since it has to do with the diagnosis, since it's going to be a more lengthy conversation, you will have to offer services, whether the VRI or the live interpreter, since you'll have to have that conversation at an appointment.
Exactly. You have a couple of options here. You kind of have to look at the situation. First, you can contact your interpreter service or VRI provider and see if you can set something up immediately. VRI, you probably can. You'd probably be able to get a VRI interpreter. But if not, then as long as it's not urgent, like something needs to be done in the next day or two, you can potentially, I mean, presumably this individual had some, I hope that person's doctor, whoever ordered the lab tests, planned on having some sort of follow-up appointment with this individual to go through the diagnosis, okay? So you either try to accommodate that person immediately or you reschedule them. Now, make it as soon as possible, and where the sort of subjective component comes in is, are you gonna scare the life out of your patient by saying, oh, well, we should really treat this like a serious appointment, you know, but come back in 2 days. I mean, you're gonna scare them half to death. So you're gonna have to sort of be mindful of what's happening. I mean, frankly, I don't know, you may already have internal policies that say, you know, if this person has a follow-up schedule, you tell them, oh, I'm sorry, we're not able to discuss that. You have to go to your follow-up. Something like that. You know, come up with some reason that's not gonna take years off the person's life while they wait for their next appointment. So, assume you decided to contact your interpreter or VRI and they're available. You know from previous experience, however, that a last-minute interpretation service is not covered by Dan's insurance. So the cost of the interpreter will exceed what you will earn from Dan's visit. Can you use VRI instead? You can absolutely use VRI. Could you choose to, at this point, reschedule the appointment? And say, oh, I want to reschedule it so we have more time.
Not because of cost.
Right. You shouldn't be considering cost. Now, this is a little bit of a gray area, because you're going to have to decide, is it going to benefit this person's health care? Remember, that is our primary consideration, is this person's health. Is there a benefit to them knowing today versus a week from now or whenever? And if so, then maybe you go ahead and offer them an alternative service that day, because that's what you need to do. But otherwise, you can either, if it's a pretty, I guess, non-serious diagnosis or something like that, like you're just telling the person that they have some sort of treatable disease or something like that, then maybe you just reschedule at that point. I mean, it's okay if it's a couple of days and it's not going to hurt the person's care. But generally speaking, if that's what they need and you need to tell them right then, you just have to bite the bullet and pay for it. Okay. So, example number 3 is our last one. And when this was small, it looked a lot like a woman doctor. And then when it was big, I realized it was like a pet store. But work with me, because it's a white coat. What am I supposed to think, right, when it's this big? So you're at your, part-time job as a veterinarian. And Anna B. Nana is a new patient. She is 5 years old. Her mother, who is clinically deaf, will be attending her initial visit with you to discuss potentially having Anna's tonsils removed. Anna's mother does not use or understand ASL and prefers instead to communicate in writing. What should you arrange for the visit, if anything? Go ahead. I heard something. Yeah, go ahead.
So since she doesn't use it or understand it, we wouldn't be doing the live interpreter services, but we would still want to offer it and document it in the chart that the client's mother prefers to do the communication in writing.
Exactly. You're going to just provide what she's used to using, right? No use in providing the gold standard if she's not going to understand what is being communicated. So first of all, you're all right. Nobody questioned this. This is this child's guardian, so you absolutely have to accommodate her in some way, right? But since she doesn't understand ASL, you could consider a transcription service, because this is a pretty important appointment, right? I mean, you're talking about a surgical procedure. Or in the very least, maybe a note taker. I don't know if in any of your offices you would have a scribe or someone like that, but because depending on how much is being said, it might take some time to actually communicate a lengthy amount with just, say, a hand note taker or something along those lines. So this is where you might need to look into other services like a transcription-related service. Okay. This is an example of when you might want to use pictograms. So if you have someone, the parent, you're kind of writing back and forth, then to sort of streamline things and make it clear, you might refer to some pictograms, especially with respect to the medication, if they're going to have any medication dosages, that sort of thing. Okay. And that's it. So, are there any last questions? All right. Well, very good. Thank you all so much for participating. I appreciate it.